This is Jason Coppola with the Connecticut Department of Veterans Affairs. I'd like to welcome you to the 2 p.m. session. We have Advanced Behavioral Health Inc. Military Support Program. They will be presenting a slideshow about their program. The session is being recorded. We'll take questions at the end of the slideshow. And we suggest you keep your camera off if you're jumping into this session, so it keeps the bandwidth down. And just keep your mics muted until you need to speak. And if you need to raise your hand, just hit your icon. And with that being said, I'm going to turn it over to Albert, and he'll go through his spiel. Thank you. All yours, Al.
Okay. Hello, my name is Albert Galorn, and I'm a family therapist, and I'm a community clinician with the Military Support Program, which is located in Middletown, Connecticut, although we serve the entire state. Also with us, I work on the clinical side, where I do provider linkage for counseling of various levels of medical necessity. Then we have Sean Carey, who I'm a Vietnam veteran. I was a combat medic with the 9th Infantry Division, and I began my counseling career in Vietnam, and I haven't stopped. We also have Sean Carey, who works with a portion program where he connects people to communities when they call in and need services that they can't get or need some help advocating for themselves with benefits or with finding community resources. We provide statewide services, referral services for veterans, National Guard and Reserve members, and their families. So the fact that a veteran served, if they call up and their children need counseling or their children need resources or their spouse or their parents or their significant others, we're willing to go to bat for them and find them resources and services that they can afford. The counseling services are confidential, they're governed. We are funded by DEMAS, Department of Mental Health and Addiction Services. And we provide our services in a strictly confidential way, which means that we do not release any PHI information, physical health information, or personal information without the express written consent about what we're releasing. The services that we provide are locally available. We try to find services where a person can easily access them through local transportation or their own transportation or local transportation. We serve the whole family, and as I said, we serve spouses, children, grandparents, significant others. People don't have to be married if they have a relationship. Why? Our service originally was started in 2007, where there was a 33 a day suicide rate among combat vets. People were not encouraged in those days. In 2007, people weren't exactly encouraged to report that they had emotional or mental health concerns. When people did report on their careers. Also, back in the day, there wasn't the same kind of network of services that we have today, where usually the services for veterans and their families are highly coordinated. One of the main places of coordination is called the Military Community Coalition, where about 40 to 50 representatives of different agencies serving veterans and their families get together to coordinate. And one of the parts of that meeting is called a case conference, where one of us will bring a complicated case that has a lot of different needs: finances, housing, marital counseling, child counseling, all of the above. And we will then all sit down together and try to put together a patchwork of services to try to hold that family. Uh, and it's broad reaching. Just to give you an example, we had a combat veteran female medic who was living in Georgia, whose daughter was up here in Connecticut, had been living with a family member. The family member died, and the rest of the family didn't want to take care of the daughter. So she was down out of state, and DCF had given her a 2-week window to get the daughter in her custody, or she would go into DCF care. So we brought the case to the coordinating committee, and 4 agencies got together, came up with the funds to be able to transport the daughter from Connecticut to the community that the mother was from. So that's the kind of far-reaching kind of services we all provide. So we're a link in the chain. We're coordinated with all the standard services that are providing for veterans and their families, such as the vet centers, the VA, a lot of the different community providers, including the people that supply horse therapy and service dogs, and a lot of the community resources that are located in each town. Many people, I remember when I first entered counseling, that it was a frightening process, and I had already been a counselor for 2 years. But basically what happens is you have a lot of people have a lot of scary thoughts and scary feelings inside that they don't know what to do with, and they haven't been trained to deal with them. And they're afraid, they feel ashamed, especially soldiers have been trained to be self-reliant, to take care of issues themselves, not show any vulnerability or weaknesses. So going to a stranger and revealing all of the uncomfortable thoughts and feelings that you have is a daunting task. Also, a lot of times, the veteran services are a bureaucracy. And if you don't hit the right person who's helpful and cooperative, it's very easy to get lost. So we provide the contacts, help the person get through the system, learn what the system is all about, and throw some blocks and some help in advocating for the person to get the services that they need. So it's easy to access our services. It's a phone call and a 20-minute interview, and off we go. We also, in the practitioners that we pick, if it's counseling, I usually prep the wood line by going in and talking to the therapist and making sure they have familiarity, with military life and the issue that the service member or family member is presenting to us. The other thing, especially in the early days, people were uninsured, underinsured, or had a high copay. So if you come in and you have insurance, but your copay is $90 a session, and your job is a low-paying job, then you're not going to be able to afford the counseling out there. And that's where we come in, where we find a way to get you into services that you can afford. So what do? So we provide linkages to services. If you call up, we have access to your insurance provider's directory through a number of different means. We will obtain a list of local providers who indicate that they have training and experience in the issue that you're presenting. We call the providers up and verify that they are available to see you. And we keep on going until we find at least 3 therapists that we can hook you up with. We give you the names and we follow up. We get your permission to follow up and call you up. and to make sure that you're connected with a therapist or whatever resource. And if you're not insured, we work to find a way to get you access to no-fee local or state resources through our case manager. What do we do? I mean, what do we cover? Marriage and family problems, depression and anxiety, PTSD. Family members experience difficulties related to deployment, emotional and behavioral problems facing children and adolescents. So when you become part of the military, either the Guard, Reserve, or active duty, whatever branch of service, they own you for the period of time that you've contracted to serve. And they can call upon you to be deployed anywhere in the world or in the United States where there's service and where there's a need. Sometimes that deployment is rapid, and other times there's 6 months and sometimes even a year before you know that you're going to be deployed. This has a major impact on yourself and your family because it creates a great deal of change. And so however well your skills are to manage change, and you do better than other times. The difficulty too is there are so many unforeseen things that come up during deployments that it's very hard to plan for each one until they occur. Also, children don't like to see daddies and mommies go away for a length of time. They don't understand it. There are a lot of books and there are a lot of services that you can tap into to help with the children whose parents are being deployed. Substance abuse and alcohol usage to manage change are large problems. Some of the substance abuse occurs when people are over-medicated by pain and other meds. And this is a large problem, especially among older veterans who have suffered injuries and have been taking pain medications for a long time. So we work, if we get calls like that, we work to help people manage the substance abuse, get the kind of help that they need, and get treatment and also follow-up care. Another part that's not here is care for the caregivers. Many veterans are living with caregivers who spend a great deal of time taking care of the needs and skill deficits that the person has, especially with PTSD and with TBIs. A lot of times you have to rely on a family member to help you keep track of things and to maintain yourself. Well, they have a great deal of stress. And recently, there are more caregiver services designed to help the person who's taking care of the veterans. There's some financial assistance, and there are also programs that we can access for the caregivers to help them keep going. Case management services. Basically, whatever the need is that a veteran has, or whatever the puzzle is or the question, we work through our partners and we work through gathering information to be able to provide a connection to a resource to help improve the person's condition. We've had people call up, just to give you an example of things, we've had people call up from out of state that didn't know what to do about accessing their benefits, that had questions where their benefits were cut off. And we were able to, through the internet, access the exact service that they needed to contact and help advocate for them out of state. We also have provided services and education for caregivers who have a lot of questions and don't know the system as far as benefits. The other thing that we're aware of is that a lot of times when veterans have emotional problems, their spouse doesn't know who to contact to be able to begin to develop a way to get them into service. So we will provide a conduit of information, either counseling for them or also help them connect with the specific type of services that they need to get their partner into care. So there are a couple of ways to connect with us. One is from 8 to 5 in the morning, we have a main call number, which is 866-251-2913. We also have an embedded clinician program where we provide up to 23 licensed clinicians who are attached to a specific guard unit, and they meet on drill each month that the guard has drill. And the embedded clinician becomes a trusted member of the unit and helps to have soldiers have somebody on the grounds if they have different needs, either for case management services or for the needs for counseling services for themselves or their spouses or children. And that person can help begin the process of connecting them to local community resources. They're familiar. They maintain coordination with the point of contact with the unit around behavioral health matters by being visible and having people know them, break bread with them. They break down a lot of the barriers around people feeling vulnerable to talk to a stranger to get services. They also follow up within the unit to make sure that the connection to the service happened. And they also, as we move along, when issues are identified, they also assist with providing individual and group education for issues such as being a survivor of suicide or specific issues related to the impact of deployment on themselves and their families. And that ends my presentation from the slides, and I'm open to questions and answers at this time through the chat.
Thank you, Al. Great presentation. I learned quite a bit. Does anybody have any questions for Al or for anybody? If not, I could stop the recording and we could call it a day.
Okay.
All right, let me stop the recording.